To be honest with you, I think I've seen some Invisalign, some patients with just built with very small looking teeth. Just built very small looking teeth, but they're huge. They're big but small looking teeth. How can we help with that? Like usually for Invisalign, what would you do?
Yeah, so that is also part of my discussion with patients. So we will talk about like the size of the teeth. Is it something that they are concerned about? Because sometimes we will find patients, they will say, I don't like my teeth, it's too big or it's too small. And sometimes it may not be all the teeth, it could be some of the teeth. And then they feel it doesn't really fit their personality. So in terms of the position, Invisalign can help. We can shift things around. Sometimes we can make teeth look slightly smaller by shifting them in and things like that. But if it needs to be larger, then that's something that Invisalign can't really achieve for the teeth. They can't really change the shape.
Because you can't really close the spaces, right? Because once you close the spaces, they just start stuck with just small teeth. Or the arch.
I think you mean that when people have small teeth, sometimes there is a sort of presentation where people come with spaces between the teeth, like the jaw is wide, but the teeth are small, so there's spaces in between. Yeah. So in these cases, then if they are concerned about how the teeth looks, and also another consideration is the position of the tongue, whether there is enough space for the tongue, but that's another topic.
Okay,
that's like airway and tongue position. But we take all that into consideration, and sometimes it could be, we call it a Bolton's discrepancy. That means the top teeth actually need to overlap the bottom teeth, and the top teeth need to be wide enough so that they can overlap the bottom teeth. So if some of the top teeth are too small, what could possibly be planned together with Invisalign is that if the patient wants to have a wider smile or larger smile, then we could plan to have some sort of restorative treatment with veneers after the Invisalign.
Or some fillings.
To sort of bone it and make it a bit larger.